Hi, my name is Jennifer Bervin, and I'm the Director of Insight Alliance and the Promise Center. We are located in Johnson City, Tennessee. Several of our services cover Washington County. However, my colleague here, Jason Abernathy, he'll introduce himself. He covers the region. Jason?
Hey everybody, so I'm Jason Abernathy. I'm the Region 1 Lifeline Peer Project Coordinator. Project Lifeline started back in the summer of 2013. Basically, I cover the upper 8 counties of Northeast Tennessee. So Carter, Unicoi, Johnson, Sullivan, Washington, Hancock, Hawkins, and Greene. And basically what I do, I'm a person with lived experience. I'm in long-term recovery from addiction to alcohol and prescription opioids. So I travel around the region and give talks and provide education and share my personal experience with addiction, to try to help folks understand addiction as a disease, and also to help folks learn about services available for their family members, their friends, their loved ones, and help get them plugged in to treatment throughout the region, whether that be inpatient treatment, intensive outpatient treatment, 12-step programs, things of that nature. So like Jennifer said, I'm based here in Washington County, but I travel around. I am a resource, a free resource to this region. The state, I'm funded through the Tennessee Department of Mental Health and Substance Abuse Services, housed here with Jennifer at Inside Alliance, the Washington County Prevention Coalition. So if need be, I can come out and give a talk to any of your groups or individuals one-on-one. I'm a certified peer recovery specialist, and I do a lot of one-on-one mentoring with folks, helping them to start their journey of recovery.
And I'll talk a little bit about some of our services that we have available, but we're going to provide you with a handout that's going to be made available to you that will be shared to you through the kind folks that have asked us to speak today. If you're not in Washington County, we're also sending you a list of some of our other prevention coalitions that are located throughout the region. So we're going to get started with this presentation. Okay, so our presentation today is called Talk About It, Opioids, Addiction, and Prevention. We are funded by the Department of Mental Health and Substance Abuse Services for many of our programs, so we like to give them due credit. Like we said, here's our name and our contact information so that if you have any questions, feel free to give us a call and reach out. So, Jason, would you like to?
Sure, thanks, Jennifer. So when we talk about addiction, opioids has been a big focus in this region for a while now, and I know there's a lot of families who are affected by the opioid epidemic, but there are also other drugs that folks are involved with, and that can be alcohol, that can be opioids, it can be methamphetamines, heroin, the whole gambit. So when we talk about addiction, it's not just specific to opioids. But when we talk about who's affected, so who are the addicts? It used to be when we thought about an addict, if you've ever watched Andy Griffith, you think of Otis sitting in the jail or letting himself in the jail. We think about folks that are dirty, they're under a bridge, they have a long beard and long hair like myself. And that through the years when I was growing up, that was kind of the picture that we had. But when you talk about addicts, if you will, sitting in the room that you're in today, if you will look to the left and look to the right, what you will see are folks who are addicts. Addicts look like, you and I. It's everyday folks, mothers, fathers, brothers, sisters, cousins. So when we talk about who is affected by addiction, addiction affects everybody. Whether you yourself struggle or have experienced addiction, whether you have a family member or a friend, if you work and you pay taxes, we're all affected because there's a lot of folks who are in jail right now because of their addiction. And please understand, addiction, when I talk about addiction as a disease, I'm not saying that Jason's a victim and that I've got a free reign to do whatever I want. I'm not trying to make excuses, but it helps explain why people would go back time and time and time again expecting different results. So when we talk about those that are affected, it's individuals, it's families, it's the community. Again, if we're paying taxes, on these folks who are in jail, we're talking about sick people who need to get well, not bad people trying to be good. And again, not making excuses, not saying, hey, it's free reign, but, to help get that understanding. So addiction affects everybody. The individuals that were around me, my coworkers back in the day, my family, my friends, I was a tornado going through the lives of all those around me. Of course, in my mind, I thought, I'm not hurting anybody but myself, but there was nothing further from the truth. So my family, we talk about addiction, it being a family disease. Whether the family members themselves drink or use drugs, you all get caught with the fallout. You all are the ones that are enabling sometimes, doing the best that you can with what you got. And sometimes that turns into enabling us. We will manipulate, we'll make you feel some kind of a way so that you keep us afloat. Our community, whenever we are in our active addiction, a lot of times, folks are stealing things. They're, taking things from other family members, other friends, other people in the community. So that can also bleed into the workforce to where folks, when the addiction overcomes them, now they're not able to make it to work or to, perform in a safe manner, let's say. The schools, that can bleed into, and affect our kids in schools. Or, if our children are suffering from addiction, the school itself. So again, everybody is affected by addiction, whether you have it directly or not. If you know somebody, or again, if you're working and paying taxes, there's some sick folks that need to get well that are in jail. Maybe if we can get them in recovery, we can reconnect those families. So what is addiction? When someone takes an addictive substance, dependence, there's a lot of folks, if they were to take a certain amount of a prescribed opioid, let's say for 2 weeks, and they take it as prescribed, they stop abruptly at the end of 2 weeks, well, they're going to have some dependence. So there's a predictable physiological withdrawal syndrome. Okay, so some of those aches and pains and maybe feeling like you have the flu, that is from dependence. The body has become dependent on that medication, on that prescription drug. Now, addiction, on the other hand, is the compulsive use, the loss of control, and continued use despite adverse consequences. And the hallmark of that is cravings. It's like, for me, let's say Jennifer has a surgery, and Jennifer takes that medication like she's supposed to because she's a good girl. She pays attention to what the doctor says and follows it to the T. And at the end of it, she stops and she has some unpleasantries. Now myself, I try to stop, and my mind says that phenomenon of craving. It says, wait a minute, I've got to have more of this, and it becomes a fight or flight thing. It's not a matter of, hey, this is fun. Not to say that there never was any fun, but it's not a matter of, hey, this is fun, I'm going to do this some more. It becomes, I've got to have this or I'm going to die. That's what my brain told me. You have to have this. And it wasn't a matter of fun. It wasn't a matter of the euphoria. It got to a point for me where I had to have this just to function, just to be normal, just like we're having this conversation right now. So those cravings are huge when it comes to addiction versus dependence.
And I'll just add that this is where a lot of people get hooked, wind up dependence turning into addiction, is because they feel that discomfort, they feel those changes and think, oh no, I need to keep taking this, or something's still wrong, so I need to keep taking this. And so they keep taking it. So it's really important to be informed when you are taking medications of what it's going to be like when you stop.
And Jennifer's going to hit here shortly, talk a little bit about this, but oftentimes our doctors, we trust them with our care, and we trust that they're going to tell us the adverse consequences and things, but that doesn't always happen. So nothing about you without you. When it comes to your health care, you need to be asking those questions. The doctor is not in charge, you're in charge, and don't forget that. if you're not comfortable with something, you may look and see if there's another alternative. That's what I have to do today. If Jason goes to a doctor's appointment and they're going to talk about some kind of pain medication, opioids are not an option for me today.
This is also important. Obviously, many of you have children. The same thing with that is when the doctor's giving your children medication, make sure you're asking, what does this do? What are the long-term effects? What would happen if my child stopped taking this? Make sure that you understand exactly what kind of medication it is that they're taking.
Absolutely. So when we talk about addiction, again, I mentioned this before, but it's a brain disease. So it's characterized by compulsive behavior, continued abuse of drugs despite negative consequences, and then persistent changes in the brain structure and function. So again, once that psychological, you got the physical dependence, but once that psychological dependence takes hold, that's where that fight or flight comes in. And you'll hear people say, how could he do that? How could she continue to do that? They've got such a beautiful family. Y'all, I'm telling you, it wasn't that I wanted to. My brain told me that I had to. So that power of choice was gone. And those compulsive behaviors, we start talking about what does addiction look like? Okay, is your loved one or friend or relative, are they isolating? Hey, we've just had the last year where we've been told to isolate. So for some folks, I've seen a lot of people relapse because they have been in that zone where they operate from. But are they isolating? Are they withdrawn? Are they hyperactive? A lot of times, for an individual that's not addicted, they may take a pain medication and either feel sick or sluggish, or it may knock you out and go to sleep. Well, someone like me, if I take pain medication, it revs me up. I end up with energy. I could show you around my house several projects that were the product of opioid addiction, because I'm like, man, I'm feeling good and I'm going to get stuff done. And it wasn't so much about, being loopy and woohoo. I just felt like I had that energy. So again, that compulsive behavior, continued abuse, even though we're getting in trouble. And just let me throw this caveat in there, y'all. There is nobody that can beat on the addict like the addict themselves. And I know there's some people that will take exception to that. My wife, I'm grateful for her, and she put her foot where it needed to be. But, and whether she believed it or not at the time, I was beating myself up harder than anybody because I absolutely hated what I was doing. I hated what I'd become, and I couldn't look in the mirror. But, I couldn't stop either. So addiction is like other diseases. You have other things. We've got high blood pressure, we've got diabetes, we've got the whole gambit. And granted, there are folks out there who, because of genetic predispositions, they could run every day and eat right and still end up with heart disease or diabetes. And oftentimes you'll hear people say about the drug addict, they made a choice. Absolutely. When I was 13 years old, I made a choice to put alcohol in my body, and it flipped a switch that I couldn't unflip. Now, did I really know at 13 years old that was going to happen? No. And so while we beat up on addicts, I think oftentimes because, having diabetes or, eating too much sugar or eating too many cheeseburgers and getting these other diseases, while that doesn't, we typically don't beat up on people for that. We kind of talk to them, but, we don't go in and beat on them. And I think the reason why we beat so much on the drug addict is that it would just, the harm that we cause, the stealing things, the tearing the families apart. And it just becomes horrible. So, I'll challenge you with this. There are some folks that every time the Krispy Kreme hot now sign comes on, they stop and they have donuts.
Yep.
Right? Did they not make a choice and now they're in the hospital with diabetes? And again, not everybody. Some of it's genetics. But, if we can kind of enlighten at that and reduce some of this stigma, we can realize that it's preventable. Drug addiction is preventable. It's treatable. It does change the biology of our brains. We're rewiring our brains, and if it's untreated, it can last a lifetime. If you look at the pictures here, you've got a healthy brain, and then you've got a diseased brain from a cocaine abuser, and then you have a healthy heart and a diseased heart. So just looking at those pictures, and you can see how cloudy the diseased brain and heart are versus the healthy brain and heart. That's not to say that if it's treated, a lot of times these things will clear back up. The connections can be remade or rewired in our brains, and we can get back to a normal way of living, whatever the definition of normal is. I know it took a while for me personally for the fog to lift, but once it lifted, things were good, and I'm in a better place than ever.
And it can take up to 18 months to 2 years for the biology in your body to kind of correct that. And that's after they have stopped using. So it takes some time and it takes abstinence and support for them to continue to get well.
So when we talk about who's at risk of developing an opioid addiction, I mentioned before genetics. Like increased risk of developing opioid addiction if you have a first-degree relative with opioid addiction. My father's side of the family, they drank alcohol, but they had a light switch. My mother's side of the family was different. I had a lot of addiction and alcoholism on my mother's side, so there's that genetic predisposition. And while my mother or my father, neither one of them are alcoholics or addicts, those genetics played a factor. We talk about environmental factors, availability of opioids, and Jennifer's going to cover this here shortly on Count It, Lock It, Drop It. But there for a while, they were writing opioids like Tic Tacs, weren't they, Jennifer?
Yep.
And I mean, you go in, and if you have, what's funny is you have like some other medical condition, and you can barely get the medication you need, but you go in with a hurt wrist or a stubbed toe, and they'll give you 60, 80, 90 oxycodone or hydrocodone. So just that availability of opioids plus, and again, I'm not going to get into Jennifer's section, but we sometimes have these things and we keep them at home because we think, well, I'm not needing these now, but I may need them down the road. So, there's that medication just lurking around in the house. Perceived risk of opioid. Okay, so opioid use. So 75% of high school seniors perceive heroin use as dangerous, while only 40% perceive similar use of prescription opioids is dangerous. So basically what that tells us is, hey, if it comes from the street like heroin, it's bad, but it's not as bad because these come from a doctor. And that was the trick that I told myself. Alcohol was my drug of choice, people. I loved to drink. I loved it like a fish. Well, when I first hurt my back and got on the opioids, I thought, well, I'm an alcoholic. I'm not a drug addict. So, I can take these. And, a doctor wrote these for me. Now, I wasn't quite honest with the doctor about my other condition, but, in my mind, I thought, hey, this is okay because the doctor wrote this for me. And in a similar sense, when we start talking about medical marijuana, people think, hey, number one, this is of the earth. God put this here for us. Or, hey, they're using this for medical reasons. Now, while these things they have their place, medicine has its place. But we have to be careful, especially with our young people, of what we're portraying to them because they can see this as, hey, it comes from a doctor, so it's got to be safe. Psychological stressors, that was a big thing for me. I was in the Marine Corps for 4 years after high school, and I was also in law enforcement. I was a police officer for 16 and a half years. There was a lot of things that I didn't deal with because, I put alcohol on top of it, and later the prescription pain medication. Our learned coping mechanisms. Oftentimes when we're growing up, our parents hand us what they learned from their parents, and we typically do, y'all typically do the best you can with what you got. And, sometimes when we're young, we learn, it's like the old saying, well, you better stop crying, I'm going to give you something to cry about, right?
Yeah.
And so instead of getting down to the roots of things, we learn these coping mechanisms. And another big thing when we're talking about addiction or traumatic life experiences, ACEs, I don't know if y'all have heard of ACEs, but adverse childhood experiences. And that can be a lot of different things. It can be abuse as a child, it can be physical, mental, sexual abuse, it can be neglect. And it's not that you're doing, we're doing these things on purpose. Sometimes it's the child's perception. So now they start, building these coping mechanisms off of what their perception is. And again, I'm not saying that there's no consequences for actions, but instead of, beating something out of somebody or whipping something out of somebody, it might be worthwhile to do a little digging sometimes and just see, see if we can figure out what's really going on.
Yeah. And one additional thing about learned coping mechanisms, if you're on Facebook, you've probably seen many a meme and people joking about, oh Lord, I've had a day, I'm going to go have me a glass of wine. That's an example of a learned coping mechanisms. If children see you turning to substances to help cope with stress in life, then they associate that with, oh, if I'm stressed out, then this is what I need to do. So always be aware that your kids are always watching.
So let's talk about how you can make a difference. That's why you're here today. That's why you're listening to the Jennifer and Jason show, right? We want to bring about awareness and understanding of addiction. You can browbeat people all day long. If you beat people over the head with something they already know, I promise you, because I've done this, my experience, I'm going to run the other way. But when you understand and you're aware of addiction as a brain disease, then you don't always have to treat something like hammer and nail. Maybe we can have some conversations about what's really going on. We want to talk about it. We want to reduce stigma. And with reducing stigma, I know there's been times where y'all have heard, well, you know what, I drove by that church Tuesday night or Thursday night when they're not having church, and guess whose car I saw sitting there, right? So there's that stigma where people are afraid of how others are going to view them, and when they're afraid of how others are going to view them, or we're afraid of how others are going to view us, a lot of times that stigma keeps us from reaching out and getting the help that we need. So, we want to be sure, again, to have those positive conversations. Again, not saying that, hey, what they're doing is okay, they're addicted, so they can run wild. It's the Wild West. No. But let's have some conversations. Let's quit throwing stones at people, and let's realize that these are sick folks that need to get well, not bad people trying to be good, and let's encourage them and let's build them up. Let's love on them, and be stern where we need to be stern, and set those healthy boundaries. But let's do that, and let's try to reduce stigma instead of making people feel uncomfortable and afraid to reach out and ask for help.
And we also want to use caution for long-term use. We talked about the difference between dependence and addiction, but we understand people have pain. There are some conditions and diseases that require long-term use. So again, it's informed. That's one, be informed. That's one of the things that's changed as a result of the opioid epidemic, is people are more informed. And one thing that they've learned is that, for example, if somebody has to be on them long term, that women who are have to be on it for long term, that they use long-acting reversible conception. There's a condition called neonatal abstinence syndrome, where babies are born dependent upon the narcotic. They are not addicted because addiction is something for adults and older people who actually have a cognitive awareness of that drive. But no, they're dependents. Their little bodies are dependent upon it. So if you have to be on it long term, make sure you're using something that can prevent pregnancy to prevent that effect on the child. And if you're on long-term use, co-prescribed, you should have naloxone on hand, whether it's co-prescribed by a doctor. There's also programs available where you can have that, where you can get it for free. In case of an accidental overdose, accidental ingestion by somebody else in your household, or just that you've accidentally taken too many.
And a real quick tidbit on naloxone for those of you who aren't aware, it's also called Narcan, but it's basically the opioid overdose antidote. So what naloxone does, in a nutshell, when a person goes into overdose and you use naloxone on them, it goes in and it knocks the opioids off those receptors to bring them back, to give them a chance to survive. Now, there's a lot of controversy around this. Some folks say, well, we're just encouraging them to push the envelope, and that the studies and the numbers and the data show that's not the case. If somebody is gone, if they've left us permanently, there's no coming back from that. So, we want to give people that chance. And it's easy when it's not your family member or friend to step back and say, well, why do you keep saving them? But when it's somebody that's close to you, it's a little bit easier to understand. So there are resources in the region. We have a regional overdose prevention specialist, Sherry Barnett, that we could put y'all in touch with if need be, if you have more questions about naloxone or getting naloxone.
Yep. So then we're going to phase into the prevention part of this. And so like we've said above, talk about it. And we will keep saying that, and we'll actually talk a little bit about that at the end. But talk about it to young people, to friends and family. What do you talk about? Talk about addiction. Talk about your family history. Talk about your own experiences if you've had them. Talk about the dangers of using drugs and alcohol to your kids. Whatever it is, talk about it. Get it out in the open. You know, things that are in secret and in the dark, they fester and they grow. So if you can get it out into the light of day, sometimes that helps to prevent that. Ask questions of prescribers. We've mentioned this before. Is it addictive? What can I expect? Is there an alternative? There's actually studies that have shown that alternating acetaminophen and ibuprofen have just as much pain relief for short-term acute pain like surgery or dental work, that it has just as much effect than prescribing opiates. In fact, it does a better job. Is there an alternative? Is there something else I can do? And to kind of phase into our next section is to lock up your medications to prevent diversion. And diversion is when your medication goes somewhere other than in your body or get disposed of. So that brings us into count it, lock it, drop it. It's a strategic approach to prescription drug abuse prevention. Basically, it helps us understand the importance for locking up your medication and disposing of it properly, and to keep track of it while it's in your possession. So let's look at each of these. First of all, I want you to think about the medications that you have in your home. Are your medications at risk? How many of you have these risk factors? I do not have a secure place to lock up medications. Do you have a lockbox, a locked cabinet, or a drawer? Do you have somewhere to put it that's safe? It doesn't have to be fancy. We have lock boxes available. Many of the coalitions do, but even if you don't have one of those, you can put a little padlock on a very simple tool chest that you can get from the store. So there's a lot of options for keeping them safe. I do not count my prescription and over-the-counter medications. So it's important that once you get a medication that you make sure it's being taken properly. Stopping every now and again to count how many pills are left in the bottle, it does two things. One, it makes sure that you're taking the right amount. Are you skipping doses? Are you forgetting? But also to find out if any are missing. Are you taking too many? Did you forget and you took it once and weren't sure, so you took it again? So just finding some way that you can count and track your prescription medications to make sure that they're not missing, but also that they're being taken properly. Some of the other big risk factors, you have children or teens in your home. Do you have frequent visitors, family, friends, maintenance people, if you live in some apartments? There's a lot of people that come in and out, and any of them could very simply slip into your unprotected medicine cabinet and pour a few pills out and walk away. Have you ever had your medications disappear, or you know that they were stolen? And do you take a medication that is high risk to be stolen or abused? One of the reasons I suggest that you make sure that you understand what medications are is that you understand what those high-risk medications are. We do outreach at events at the fair, and I talked to a lady one day and she said, oh, no, I don't take any of those pain medicines. I just have my nerve pills and my heart pills. Well, it turns out, those nerve pills is often, Xanax or some other things. Those are addictive, and those are at high risk of being stolen or diverted.
And another thing, just real quick with that,
Yeah.
like the heart pills, You know, kids a lot of times, or young people, they don't, and even adults, they don't know what they're taking. You know, they'll just see something on the counter and grab it and go. And, you know, where your blood pressure medicine may be exactly what you need, if one of our kids or you know, a visitor or somebody comes in and they take a couple, 2 or 3 of our blood pressure medicine pills, you know, they could have a really severe adverse effect from that. So, you know, it is real important that all these things, really, when you think about it, that they're secure.
One other important thing to note also is that pet medication. It's always important too that you should ask your veterinarian what your pet is taking. I talked to a lady one time. She said, you know, I keep all of my medication locked up. She said, but my cat's Valium. She said, you know, when it thunderstorms, he would freak out. So the doctor gave me some pills for the cat, and she said, I didn't realize it was actually Valium. She said, I thought it was like a euphemism, like, oh, this is like Valium for cats, but actually it was Valium. And she said that one day she went to get in her knitting bag where she kept it, and the whole bottle was gone. Somebody had stolen it from her. So making sure that whatever medications, whether it's your human family or your pet family, whatever you have in your home. And just to note, that, you know, one of the things it talked about in the second point is over-the-counter medications, knowing that certain cough medications and can have are often sought after by young people for abuse, well, and adults as well. So just be aware, talk to your pharmacist when you get an over-the-counter medication. What does this do? What should I know? What should I be aware of? And often you can tell what those medications are because you a lot of times have to show ID for those at the drugstore. Oh, count it. We talked a little bit about this. You know, this is a fancy chart that we have, but counts every 2 weeks or every so often. Just take time to make sure what's left in the bottle is what should be left. This will prevent theft and ensure that your medications are taken properly. And then discuss locking up your medications. Again, we kind of touched on this. This is an example of the lock boxes that we have. It's not a vault. It's not a airtight safe. You know, and that's not really the point of having a lockbox. It's to create a barrier. Most diversion of medications take place by someone just walking up to the bottle, pouring a few pills out, and sticking them in their pocket and walking off. If somebody took a baseball bat or a pry bar to this, yeah, they could probably break it and get in it. However, you know, that's, like I said, this is just to create another sense of barrier, and it sends a message that, hey, I'm paying attention. I know what, you know, I'm trying to protect what we have.
And I'll throw in something on that. You know, it does create that barrier. You know, a lot of times folks will keep their medications on a windowsill, or they keep them in the bathroom in their medicine cabinet. And, you know, something to think about, if you just had a surgery and now all of a sudden, you know, your nephew, your niece, your brother, your sister that you've not seen in 5 years shows up at your house and says, hey, I heard you had your surgery. I just want to check in on you. Can I use your bathroom? That might be a sign that they are coming in looking for medication. So, again, when it's with that lock on there, it has some cause for pause and some hesitation. Whereas something just up on a windowsill or in a medicine cabinet. Plus, the thing about a windowsill, you know, folks outside of your home can't see what's inside your medicine cabinet. But if somebody's walking around through your neighborhood and they walk by and they say, there's oxycodone and Xanax and Percocets and, you know, all these other things sitting right there on the window, there's nothing to say they won't smash that window out and just do a smash and grab. So again, just some food for thought.
Yeah. And, you know, we've also, during our outreach, we've had people tell us, well, I take a lot of medications, but none of it is anything that anybody wants. But the thing of it is that if people see a bunch of medications, if they see a bunch of pill bottles, they might be curious as to what's in them. So just being careful and protecting that. So one of the things about the drop it part is dropping off your unused expired medications for proper disposal at law enforcement sites. There are a lot of different places. Our next So there are permanent places that you can go, and there's also events. So if you go to countitlockitdropit.org and you go to their Dropbox finder, you can find where the permanent drop boxes are. I will tell you that most police departments in the region have one. I will add that not all of them are available right now, so make sure that you call ahead of time. Now, we also have events on Saturday, April 24th, next month on a Saturday from 10 a.m. to 2 p.m. These are the known places where they are holding events where you can literally just drive up in your car, roll down your window, hand them your bag of medications. So you've got about a month and a half to check your medicine cabinet. They take both prescription medications as well as over-the-counter medications. Check those expiration dates. Make sure that they are, they're, still happening, or that those boxes are available. Again, the drop-off events, they started up again in October of 2020. Some of the important things, and this is a list, I guess I got those two pictures confused, but this is the actual list of where some of the drop boxes are located in the region, that I just discussed in the last slide. So, like I said, you can take a look at those, but like I said, it's mostly police departments. There are some pharmacies now that have it. And again, you can Google medication drop boxes, where are they, and you can find some lists. So drop-off events, they started back up in October 2020. We encourage you to leave the label on. If you want to mark out your name, you can, but they incinerate the whole bottle when they do it. And what we've learned is that 8 to 10% of what comes back is controlled substances. So we know that it's working. We know it's getting it out of the home. However, and that's because a lot of people bring controlled medications. They get rid of that old Tylenol or those old vitamins. However, about half the people who come bring at least one item that is a controlled substances. So we know that people are paying attention and they're getting those medications out of their home. Other findings is, like I said, the locations and time are good. Mail order prescriptions do often create more drugs that need disposal. So it's important that people understand how to stop a prescription or an auto refill, or don't renew them if not needed. I know I have to keep calling my pharmacy because they keep turning on the auto refill, and I wind up with medications I don't need. So if you don't need them, don't pick them up, and just let them know, or let your doctor know. And after 10 years, we've been doing this in the region for 10 years, and we still have people who are coming to us for the first time to drop off their medications. They usually, have to hear about it, see commercials, see about it before they actually make the move to go clean out their medications. So here's your cue to go check out your medications. Go clean out your cabinet or medicine cabinet or wherever you keep them, and go through them and see what it is that you need to get rid of. So now we're going to talk about it. And that's our thing. Drugs and alcohol are kind of a big deal. Talk about it. This is a really important thing as parents that you should be aware of, and that you should make a commitment to today watching this. We do surveys every so often in Washington County, but I do know that the results are very similar around the region. On average, only 56% of 8th, 10th, and 12th graders report that their parents discussed the dangers of alcohol or drugs in the last year. We find that when kids are younger, like 6th grade, elementary school, that a lot of parents have that conversation. But the times where it is really necessary and really needed, 8th, 10th, 12th grade, parents are talking less and less about it. The other thing that has been shown is that research indicates that parents who have had that conversation that their children are 50% less likely to use or to become addicted as adults. So it is one of the keystones of prevention for your kids is that you start talking now and you keep talking. Now, we have a guide that we're going to make available to you through a link. And the great thing about it, you know, a lot of people say, well, how young is too young? Well, it's never too young. You're going to talk about it in a different way, but it breaks it down into different ages. So preschoolers, which is what a lot of you have, but you may have other children as well. So it has a section for kindergarten through third grade, fourth through sixth grade, middle school, high school. And folks, and some of you, if you don't have any grown children, I know mine are both in their 20s, one in their 20s, one in their 30s. Even when they grow up, they're still your babies. And but especially while they're college age or young adults, they still are listening and paying attention, and you still have a large influence over them. So it is really important to keep that conversation going. So we're going to just take a minute. Go ahead.
Well, I'd like to add one thing to that. You know, when we talk about it, how important this is, and again, this is a beautiful evidence-based guide to have those conversations. You know, when I was a kid, basically the talk was, you don't drink. Why is that? Because I said so. So what my mind said was, hey, that's got to be fun. And hey, I've heard, you know, some of the stories from when my dad was younger, and who's he to not tell me I can't, blah, blah, blah. So the thing we got to remember is this: you, I, Jennifer, we're the parents. Now, I've not always done everything right. And I've had a lot of conversations with my daughter. You know, she's a teenager now, and by her age, I was already off to the races. But I truly believe that because of some of the conversations we have had around, you know, my struggles, and while she's not ever got the R-rated version of the story, you know, she's well aware that there's a genetic predisposition. And when we talk about, you know, alcohol and drugs and tobacco and other things and why she shouldn't do it, I explained to her why. You know, and I'm honest with her. You know, I've told her, hey, it's not that I didn't have fun. Oh, yeah. And, you know, your friends are going to tell you that they're having fun, but it robs you of who you truly are. And it can set off, you know, like myself, when I turned that light switch on at 13 and couldn't turn it back off. You know, we don't know what kind of choices or what kind of consequences are going to come behind that. So having those open, honest conversations, you know, sometimes we feel like, well, I can't say anything, I'm a hypocrite. Okay, people, how many of y'all tell your kids, if you speed and you get a speeding ticket, I am going to throttle you, I'm going to wear you out, you're grounded for life? We're not afraid to have that conversation, but how many of y'all speed? All right, now I done stepped on some toes. So the same thing with drugs and alcohol. Yes, you have been there, and all the more reason why you can tell them this is why you shouldn't do it, because you have lived experience. And if nothing else, it's illegal. Okay, it's illegal until you're of age 21
to drink
for alcohol. And then, you know, if we're starting to take other people's medications or things like that, or use other drugs, that is illegal. So it's important to remember that we have a job as their parents to make sure that we do the best that we can. You know, nobody, my mom and dad didn't make me what I am. You know, they didn't do something wrong and I turned out to be an alcoholic and an addict. It just is what it is. It was something that was inside me. So just remember that, think about that, use this guide to your advantage and have those conversations.
So I just wanted to take a minute before we close up to show you this guide that you're going to have access to. And just kind of show you a few things of what it looks like. Like I told you before, research shows that kids who learn about a lot of the risks of drugs from their parents are up to 50% less likely to use. By talking to your kids, you can help them make better choices and live safer and healthier lives. So, and it's got our number there if you have any questions or need additional information or resources. We've had parents call us and say, do you have any information about this substance or that substance or different things, and if we don't have them, we can help you find them. So this just gives some general tips, you know, about listening, helping them learn how to say no, helping them, although, you know, I know some kids like to say no a lot, but this is how to help them stand up to a friend or somebody who might be influencing them. Encourage choice, help them understand that they can make choices, that just because they're being pressured, they don't have to choose to do what their friends do. This is age appropriate information. It has some other things. Another really important point is to establish a clear family position on drugs. We have done presentation in schools. We've asked the students, what are your house rules about using drugs or alcohol? And only a handful had said that a clear message has been relayed to them. So it is really important to spell it out. Like I said, usually it's don't do that or I'll kill you, or don't use drugs or I'll kill you, or, you know, you're going to be in a lot of trouble. But again, that just makes it more tempting. But when you phrase it in such a way that we don't allow drug use by children in this family, and they're not allowed to use alcohol, we're not going to tolerate it, we're not going to stand for it, and we're not going to allow it. So making a very clear statement about what your stance is on that. And just to kind of show you how it kind of goes through, like I said, even starting in preschool, you can lay a foundation about being healthy and about decision-making skills, and, you know, understanding what some of the scenarios, and it actually has scenarios. What do you say to a 2 to 4-year-old? You're giving them a vitamin and saying vitamins help your body grow. You take them every day to be strong, but you should only take what I give you, not what anybody else does. And too many vitamins can hurt you. So you're not talking to them about the dangers of opioid medications or pain pills or alcohol, but you're helping them understand their bodies and what's healthy and what's not. So like I said, you can start that conversation earlier, as you know, early as preschool, and it goes all the way through, like I said, to all these other age groups. So no matter what age your kids are, this has got something for you. So thank you for spending a little bit of time to us today. We hope you've taken something away from this that is helpful to you. And like I said, if you have any questions, call us or contact one of our other coalitions in the region.
Sure. And again, if you have a family member or a friend, or you yourself are struggling with addiction or have questions about, you know, hey, do I really have a problem, and you want somebody to talk to, my contact information is on here. Feel free to reach out. There's no charge for what I do for the peer support. We can talk on the phone. We can have a sit down here in the office, and be glad to help out in any way I can.
Thank you.